Wow.
I caught the middle.
So they picked a favorite team yet?
Yeah. They have the Twins and the Bears. I think that's who they're playing this morning.
Maybe Jim Traber will get back into it. Now, he was in the Japanese league, wasn't he?
Let me look. Maybe that's what I should do. Korean baseball.
Where's Mr. Davidson?
Online.
Is he? Yeah, seeing MD there. Dr. Davidson. See his picture, though. Sure. Call in users.
They have a Hyundai Unicorn.
Hey, that could be the one right there.
There you go.
Him and vehicle.
Taylor's almost sporting their colors in that green shirt. Oh, good. All you need is a little bold outline. Unicorns it is.
The Hyundai Unicorns.
The KT Wiz.
That sounds like something Mr. Compton would go for. Yeah.
This is according to the internet. It might be fake.
Funny.
Dinos, the Bears, the Lions, Twins, Giants, the Kaiwoom. Yes. Tigers.
You could check their records and see who's successful before you pick a team. The Wiz may not be.
Apparently it's the Lions. They may be
Good afternoon and welcome to Emergency Response Committee meeting, and we will call roll. Mr. Matthews. Present. Mr. Blau.
Yes.
Mr. Taylor.
Yes.
Mr. Davidson.
I'm here.
Very good. Thank you, sir. And Barnes Chair, all members are present. Need to entertain a motion to reconvene.
So moved.
A motion, do I hear a second?
Second.
Motion and a second. Mr. Matthews?
Aye.
Mr. Brown?
Yes.
Mr. Taylor?
Yes.
Mr. Davidson?
Aye.
And Barnes is an aye, so we do reconvene. Item number one, motion to reopen item number one.
So moved. Second.
Motion and a second. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Barnes is an aye. Discussion possible action, set date, time, place, and meeting reconvene in the event of technical difficulties should they arise in the course of this meeting. Any recommendations?
I would move that we reconvene on Friday at noon in this room.
Okay. That would be May 8th, would it not?
I believe so.
Very good. I hear a motion to that effect?
That was my motion.
Oh, I'm sorry. How about a second? I'll second that motion. Roll call. Mr. Matthews?
Aye.
Mr. Blau? Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Orange is an
I was
aye.
an aye to clarify. Sorry.
That's fine. I had you from one anyway. Friday, 12 o'clock noon, BOCC room, May 8th. Thank you very much. Need a motion to reopen item number 3, discuss, review, and possible action regarding presentation from emergency management.
Yes. So moved.
Second.
Motion and second. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
And Barnes is
Sorry
an
about
aye. You're fine. I'm going to somewhat abbreviate this today since it continues to grow. And hit the points that have not changed significantly, I will not. I would remind her again, the first week of May is historically the peak of spring severe weather season, and encourage everyone to maintain awareness. We do have possibility for severe weather late Thursday afternoon and evening. It appears at this point to be likely another significant hail event like we have seen on a couple of previous occasions, although the other attributes will obviously be present. keep sheltering, particularly outside of immediate in-home family, maintain social distancing as possible, and make your plan early. Do not wait until impending severe weather conditions develop. On the coronavirus, COVID-19, persistence is still a preventative measure that needs to be strengthened and emphasized, including limiting travel and staying at home. We are still under presidential major disaster declaration, and the CDC specific guidance recommends wearing a cloth mask when around other people, and all organizations continue use of business continuity operation plans. We are also under a state of emergency declaration from March 5th and a health emergency declaration from April 2nd at the state level, and received notification today, as just announced, that under the federal declaration, crisis counseling is now approved. The program in Oklahoma will be managed by the Oklahoma Department of Mental Health and Substance Abuse Services through community-based outreach and educational services. Oklahoma City guidance for reopening, which began May 1st, is available upon request. In Oklahoma, 4,201 positive test results, 74 additional since yesterday. 253 virus-related deaths reported, which is 6 additional since yesterday. Largest numbers in Oklahoma County with 36, Tulsa County with 36, Cleveland County with 30. I believe Washington County was number 4, which I found a little interesting due to its size. Its proximity to Tulsa, likely something to do with that. 67% of fatalities had at least one comorbidity situation. We've had 85 seasonal flu deaths since September 1st, 3,507 seasonal flu hospitalizations since September 1st, which is almost 5 times as many as COVID-19, although COVID-19 obviously has shorter duration. Still 78 Oklahoma counties with positive cases. Test sites throughout the state, and testing is now available to anyone. You do not need to be symptomatic. And I would still encourage checking the State Health Department website for any specific guidance. Sometimes they still require appointments at those facilities, depending on where you're going to go. For Oklahoma Department of Corrections, current statistics, 990 inmates have been tested with 2 positives, 786 negatives, and 202 pending results. And all inmates that are about to be released are being tested approximately within 1 week of that release. Fraudulent unemployment claims continue to increase also, as Mr. Matthews shared with us in our previous meeting. I'm also hearing from outside entities where they have had some, and actually speaking with the law library earlier today, they had a couple over there, people that they'd never even heard of.
Yeah, we continue to get them. We've seen 3 more responses today that Karen has submitted.
Wow.
But they continue to come in, and it's really a shame.
It is. Oklahoma County in general, 853 positive cases, 36 fatalities, 612 total recovered. And we've had 5,108 tests conducted through May 5th. Tinker Air Force Base, no updated information. They still have restricted visitor guidance in place and revisions in available gates. 3 test sites in Oklahoma County, plus private labs, Fairgrounds Bennett Center, Walmart on Southwest 104th, and University of Oklahoma, OU Physicians at Northeast 10th Street. And again, Oklahoma City County Health will continue to schedule tests for anyone wishing to participate. Just contact their helpline, which is 425-4489. And the state 24-hour hotline is still 877-215-8336. Shelter operations continue to ramp up in Oklahoma. There's an article by the Journal Record that I received from Christy Kerrigan Marshall, thank you for that. A couple of sites available in Oklahoma City now in support of up to 190 Oklahoma individuals experiencing homelessness. And further details, I can provide these to you, or you can find the Journal Record article online. PPE supplies continue improving. Supply lines are starting to backfill a little bit. City County Health Department is still requesting donations. If you can assist with that, please go to their website. Internal Oklahoma County government, we're still under an emergency declaration from March 25th. still encourage ReadyOp registration. I've pulled together and worked with Mr. Matthews yesterday on a draft reopening document. I have copies of that with me, and we'll certainly provide that to members of the committee or others who are interested. The main purpose of that is to put basic guidance in the hand of employees when we do a reopening. So if they have a list of what has taken place at Oklahoma County, preventative protective measures have been in place through facility maintenance and other activities, and what the recommended guidance and responsibilities of the individual employees may be at that particular time. And again, I can provide copies of that if you're interested. District Attorney's Office is to return to full staffing May 18th with what is called a soft opening. Oklahoma County Court Clerk's Office is still providing marriage licenses with pre-prepared paperwork and appointment, and they are continuing to work on reopening procedures and strategies. The Oklahoma County Clerk's Office is now on a 9 to 3 p.m. schedule. County Treasurer is taking payments on the third floor, one person at a time, and a mask is required. On May 5th, we had 199 through the door, which is, I believe, an all-time high since we started doing these counts, with 39 inmate shuttles. Still no update from FEMA in regard to the Community Disaster Loan Program, which has been requested through Oklahoma State Office of Emergency Management. They have made application. The Oklahoma County Emergency Management First Responder Personal Protective Equipment point of distribution is still in place, and we've got our 7th consecutive process we initiated yesterday. I just received a call. Those materials are ready to be delivered, so we'll be taking delivery of those likely this afternoon for subsequent distribution throughout Oklahoma County and some adjoining counties tomorrow. Court and courthouse related, I met with the law library folks this morning and assisted them with some reopening planning. Changes include social distancing and the inability to, what I call, hang out between cases and proceedings in the law library. I know it's a common practice. It's a quiet place of seclusion when you're waiting on your case to come up. But because of social distancing and the numbers potentially involved there, they're going to disallow that, at least for the time being. Expanded operations are to begin May 18th. As we've heard, jury trial and non-jury trial schedules now include the second half of August and then into September. June 5th jury week proceedings have been canceled. Traffic court July 24th. Foreclosure sales are to resume June 20th. And for the Sheriff's Office and Under Sheriff Blake, who was with us at our last meeting, the Sheriff's Office is planning to provide additional deputies to assist with social distancing and other situations beginning on the 18th when the courthouse does resume business. And the East Courthouse entry remains closed until then. Notable, Oklahoma Medical Reserve Corps is still accepting volunteers. Warning signs and symptoms per CDC have not changed. Personal protective measures remain consistent. Frequent hand washing, cover the cough or sneeze, wear face mask in public, social distancing, and stay home if at all possible. One note that I would add to that I found interesting that I received from City County Health Department regarding the use of masks. There's a lot of questions about masks. The actual use of N or KN95 mask is recommended for healthcare providers or those collecting test samples. Cloth mask and procedural or surgical mask is a recommended procedure for general public use. Reminder, primary method of spread is person to person through coughing, sneezing, and contact with airborne droplets. Blood supplies are still low, encouraging blood donation, and be sure and use credible sources for information. Social media and some media sources are providing information that less than desirable. Take personal responsibility, practice prudent preventative measures. With the exception of questions or discussions, that concludes my report for today.
Okay, David.
Sir.
As we discussed in our last meeting, a question regarding temperature scanning has been submitted up to the DA's office.
Very good. Appreciate that.
They are looking at that. This is something that Miles has brought up in the past, but since he's joining us by the phone, I will raise this. Are we aware of any change in the Department of Corrections status with regard to beginning to relieve the backlog that we're now seeing in our county jails? As I understand it, we're up to about 281 individuals that would need to be transported at some point to Lexington. So I'm curious if you've heard anything.
No, I personally have not, and I was on the DOC website earlier today looking for revised statistics on their testing and positive cases and saw nothing in regard to that. Miles, have you by any chance heard any updates? As far as
No, but I've got no updates from DOC, but one of the reasons I'm not there is that I'm meeting with some of those individuals, or some other people that could reach out to those individuals here in a little bit. So I'll just have them reach out and then we can get an update Wednesday, or I can email it to you, David, and you can distribute it. So either way.
All right, yeah, if you send that to me, any information you get, I'd be happy to share that with other members of the committee. Joe, any other questions?
Well, and then yesterday, there was a special BET meeting. Discussion topic was the CARES funding that the county has received. I think there's a budget board meeting to set up a cost center on Friday. But as we're looking at the use of that money, and I know Cody raised this, one of the things that I think we need to consider is a supplement to city-county health. Now, there's some questions regarding is that permissible? Certainly, if you look at city-county health in terms of being a healthcare provider, but whether you can specifically transfer it to another governmental entity such as them, that question needs to be asked. I've reached out through some intermediaries to try to get some information on that, but haven't heard anything. So city-county health, I think, should be something that we're looking at to consider using some of those funds on. Additionally, the guidance that came out from Treasury that was discussed in that meeting allows for either a transfer or a loan potentially to cities that did not receive CARES funding. I don't know that we're there yet, but certainly, David, that would be a role that you could play if we get into that area of helping us to gather what costs they've had related to responding to COVID-19. And not to mention our own expenses. So those are some areas that I think we should begin to perhaps, yeah.
Joe, has City County Health asked for dollars?
Multiple occasions.
And are they asking the same ask of the city as well?
It is my understanding, Michael, that the city of Oklahoma City is looking to provide some additional funding to City County Health, and that they would hope that Oklahoma City do the same as the joint commission of Oklahoma City and the county.
And has there been a specific dollar amount, or they're just asking?
To my knowledge, to this point, they haven't sent that dollar amount over yet. It would be forthcoming at I would say relatively soon. Sure. So there are. So at this point, I think Oklahoma City is looking at their options to help with funding. OCCHD would like for us to look at that as well.
Thank you for that, John. I believe that would be prudent as well. I'm interested in seeing how that goes from a legal perspective as well as availability and CARES Act guidance.
Well, and as Cody's pointed out, there will be some legal guidance necessary, but these are funds that are not ad valorem based. So, you know, whether these funds are subject to the same restrictions, probably have to be determined. But, you know, if you look at the guidance from from the feds as to what this money can be used for, and start that as your starting point of the analysis. Perhaps we'll have a little bit of flexibility and able to help some of our local jurisdictions and other governmental entities that have
Excellent.
borne a significant cost here. So,
I have been also contacted by some of the smaller jurisdictions in that regard to CARES Act for the expenses that they've incurred. Going to be any pass-through or sharing of those funds or whatever. They basically tell them we're waiting legal advice first and then guidance from Treasury.
yeah, one of the concerns I think that they talk about in UT, and I think it's a valid concern, is obviously these funds must be spent according to Treasury's guidance. And, if money is transferred to another government entity, part of it's liable for repayment in the event that they're not, or is that something that we can do via the transfer language that would specify that the receiving entity is responsible. But, so there are certain things, you're exactly right, that need to be looked at.
Yeah, subdivision of the audit responsibilities would make sense there. Very good. Thank you. Any further discussion or questions regarding item number 3 or topics we've been discussing?
Well, my understanding, smaller municipalities are to be directed to the state at this time.
The CARES Act or
I think my understanding, the state hasn't shared any of their allotment with anybody. I just hear that via news reports. I don't have any direct insight. But one of the considerations in that, and that came up in BET, the issue of smaller municipalities getting money from the state, I certainly think it would be prudent if we're going to consider making allocations to those entities to find out whether or not that they have received or have requested an allocation to the state. That we're not, I think is probably not the right word, but they're not receiving some from them and some from us in the amount that is in excess of the amount that they need. I could potentially proceed maybe the state granted some, perhaps if the county were able, granted some to try to make some of these entities whole. But
sounds like a collaboration and some type of formulation to come up with those dollars if in fact they can be provided to those jurisdictions might be good to prevent, as you said, the overlap in funding and still help meet the needs of those smaller communities. Very good. Miles, did you have a contribution, sir?
No, I think Michael said mostly what I was going to say. The communications that I've had with Treasury and the White House has been that the local municipalities that did not get funding direct are supposed to direct their ask and their request to the state, that the funding for those individual municipalities was given to the state to dole out. Now, I think the confusion comes when, in the guidance, it says that we can give it to other government entities, but we don't have to. So Joe would probably agree with me on this, that the guidance reads like stereo instructions. It's clear on some things and really not clear on most.
I think the guidance, Miles, is crystal clear that we can pass those funds along to other governmental entities, including our smaller jurisdictions.
Yep.
So
yeah, I agree with that. I agree that it says that we can. I certainly agree with that.
My only thought on that is that some of our communities, they're just wanting to plug in their budget shortfalls.
that would be contrary to the guidance. They could, whether they got the money from the state or from the county, that would be impermissible to do. This is not a revenue replacement measure. This is money that is specifically to be used to cover expenses beginning March 1 through December 30 related to COVID.
And I agree, and that's my concern, though, is that's what those communities are gearing up to do.
Well, Michael, I think, and Miles may be better positioned to answer this, but I believe there is consideration of another round of funding coming from Congress to help cities and towns with revenue replacement. But that's why.
Yeah, I think.
Go ahead, Monson.
Sorry. No, sorry, Joe. You were still going.
I was just going to say that's why it's important, should we get to the point of helping our cities and communities out, that it is completely clear as to the use of the money and who is responsible in the event it is not expended in the appropriate manner. So there are some things that need to be worked out, but we hear all the time, we're all in this together. And so
I can tell you that my discussions have been centered on questions that they couldn't provide answers for, but we're willing to ask the Treasury Department and make sure that, if we've got questions about things that we could spend the money on, that either they address them in the next updated guidance, which will probably be about 2 days, or on a fact sheet online or something. So, we're not the only ones in this situation asking questions for clarification. So, as we keep hearing, it's an evolving thing, and these guidelines are an evolving thing. So, we're the only thing that I'm aware of that we're really kind of in a crunch / rush for right now is making sure that Monroe and the cleaning crew is funded, and making sure that he has the funds in his budget to take care of, which this money would obviously and could obviously be used for.
right. I agree with that.
That's to say, I think we got some time. I want to say that we have a little bit of time to do this right. We have some time to plan and execute in a manner that we've never had the ability to do before. And I think we should take full advantage of that.
That's exactly what I'm talking about when I'm saying we should look to help our cities and towns and other governmental organizations. So sounds like we're on the same page.
Very good. Any further discussion on that item or related?
One more comment. Going back to numbers, we've recorded our second positive in Oklahoma County as of Monday afternoon. An individual who works in the BOCC department in this building, and that individual has since had a negative test following that, but it's still out, still quarantined, and the individuals who worked with the person who has tested positive have also self-quarantined and have gotten their tests as of yesterday. So we're waiting results on that.
Very good.
So that's our second, which, given all that's going on, I think we're in good shape with the numbers. And as soon as we know a little bit more on the other individuals, whether they have positive tests or not, we'll let this committee know as well.
Very good. Thank you for that update. Any other comments, questions? Entertain a motion to accept the report under item number 3.
So moved.
Second.
Motion and second. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Barnes and I, thank you. Item number 4, discuss review possible action regarding presentation from BOCC departments. Anyone care to present, or do we have any information from those? Seeing and hearing none, no action on that item. Item number 5, discuss review possible action regarding presentation from facilities management. Mr. Monroe, would you care to update us? Motion to reopen item number 5.
So second.
Motion and second. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
And Barnes and I. Thank you, sir.
Yes, the additional cleaning crew is ready to begin. We'd like to start early, assuming funding will be put in place so that we can begin to establish procedures on each floor. Also, we're working with contractors to build plexiglass screens. They're located now on each of the floors, and we're doing in the annex. the treasurer, the county clerk, court clerk. Also, we're building those screens for judges, benches, and the courthouse.
You know if that supplemental funding is an item on the budget board meeting for Friday, by any chance?
I have not put anything on the budget agenda.
Or wherever that may need to go to allocate for your budget?
So the way I understand it is there's a cost center and a line item created on Friday. So the question kind of lies, is it a budget board decision on the money, or is it BOCC? That's probably what needs to be cleared up first.
Okay. Oh, I got you.
What's the cost?
Yeah, that's the CARES Act cost center that we're talking about.
Yes.
Okay, very good.
Yeah.
Anything else? From Benita across there, if she can get some of the footprints, and also wants to make sure she's included in the law library for the periodic daily cleaning and those kind of things, because they've been closed, but obviously doors.
Again, we want to try and start this early to get a jump on things, so methodology can be established and cleaning surfaces early.
Very good. Any questions, comments from Mr. Monroe?
To accept the report.
Got a motion, do I hear a second?
Second.
Motion and a second. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
Barnes is an aye. Accept the report. Thank you. Item number 6, discussion, review, and possible action regarding presentations from Oklahoma County Clerk, Oklahoma County Court Clerk, Oklahoma County Treasurer, Oklahoma County Sheriff, Oklahoma County Assessor. Anyone present or wishing to provide updates or information from any of those elected officials or departments? Seeing none and hearing none, move to item number 7.
Let me go back.
Yes, sir.
I would suggest, since we still have time to amend the agenda for next week, that we add the district attorney on.
Yes, sir.
And public defender.
Might as well add the courts as well.
Yeah.
I can make that happen. Thank you. Will entertain a motion to reopen item number 7, discussion, review, possible action regarding reentry provisions of plans for Oklahoma County offices and facilities.
So moved.
A motion, do I hear a second?
Second.
Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
And Barnes is an aye. Thank you. Reopen item number 7. I'd like to give you a copy, and we'll accept this document of the reopening draft I was referring to earlier.
Motion to receive the document.
Second.
Had a motion, a second, to receive the document. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
And I vote aye also. As I stated earlier, the purpose of this, Mr. Matthews and I were discussing this yesterday. We've seen various pieces of guidance from other organizations. There was legal counsel involved for, but it was out of NACO, was it not?
ACO.
ACO. And the intent with this, if it pleases this committee and we can make whatever modifications you all desire, I have no problem with that. But the original intent was just to give an overview document to employees and personnel returning when we do the reopening or when we start to escalate our activities here at Oklahoma County. There's a couple of main sections. There's a couple of introductory overview paragraphs at the beginning. Then county preventative and protective measures is intended to be a list of the activities that have been transpiring in Oklahoma County in our facilities and the preventative and personal protection arena. Second section is employee participation, and that is simply some of the expectations that we have of employees and that we should impose upon ourselves more than anything for proven measures and self-protection. And then I added a few helpful websites, being the Center for Disease Control, State Department of Health, and Oklahoma City County Health Department, and little tips. I did have a couple of questions there at the end that you will see. But I would appreciate your feedback in regard to this document if you in fact want to go this direction. I saw it as important to put this in the employees' hands, possibly email it to everyone group or whatever, just so that when they come back, it's not like a blind walking in through the front door and what's going on, what's happening, what can I expect, what are the expectations, et cetera. Just kind of set a baseline for where we are, what we're doing, what's going on. So please take time to look through this, if you will, and any feedback would be appreciated. Dan, do you have any comments on that?
No, I've looked through it a couple of times. I've made a few notes, but I think it would be good if once everybody's had a chance to look through and digest this, is that we put our heads together and begin to make whatever modifications need to be made. I would like to offer into to our record the documents that it did receive from ACO. I emailed it to each one of the members individually. I hope you've had a chance to take a look at it. I'm going to pass that to the clerk of the board, or our clerk running our show here.
Same thing, but different.
All right, same thing but different. All right. And a lot of what David has put together in his document came out of these documents that were sent by ACO. These were created by McAfee and Taft, the attorneys for ACO, and they have put together a return to work resource packet with the blue cover, some draft or sample return to work policies and procedures, and then some self-assessment forms for employees, visitors, and contractors. Don't know how much of this we want to consider enacting, if any of it, but what David has put together with his document encompasses a lot of what is there. Now, if we want to expand on what he has and add some other pieces to that, I think we'd all certainly be willing to take a look at that as well. But as David said, I think this gives us a good roadmap of how we move forward with our reopening and directions to employees as well as our officials and the public on how we intend to proceed. So I move we accept that the document.
I will second that we accept that document that was created in help with ACO and McAfee and Taft.
All right, got a motion and a second. Mr. Matthews?
Aye.
Mr. Blau?
Aye.
Mr. Taylor?
Aye.
Mr. Davidson?
Aye.
And Largess and I, thank you. Thank you for providing that, Dan.
I would caution before we get too far down the road in reviewing this, there are some things that appear in this packet that was provided that may be subject of the question that's currently pending in the DA's office, and McAfee staff is not our lawyer.
I would agree with that. And right now, I would just consider this as a reference tool that we can use as potential guidance as we move forward with the assistance of the district attorney and their opinions on the questions that have been asked so far.
I would agree with that. As I read through that, I actually saw things that I thought to be extreme overkill in regard to Oklahoma County situation. And the points that I put in my document basically covered those items and those things that more applicable specific to us as opposed to a broader stroke, which is obviously what was provided there.
And to be fair to ACO and McAfee TAP, they do state in the document that they recognize one size doesn't fit all.
Right.
So,
And I believe that these documents were sent to all county commissioners in all 77 counties, so I would assume that all 3 commissioners here have also received it. I don't know whether they've looked at it or not, but I do believe it was sent to all 77 counties.
In that line of thought, I would note in the document that I provided, as you read through that, you'll see a couple of bumps in there, things that questions yet to be answered. Similar to what we saw and what you're alluding to, Joe, in that particular document. One of them is at the end, I put potential questions. Embedded within the document, still the question of the amount of PPE to be provided to employees if in fact we go that route. And by the way, I did receive pretty substantial bulk yesterday, although that's typical for state, not exactly what they said was coming, but very close. So I've got quite a bit of inventory for this purpose, for the reopening and for use internal of Oklahoma County government and here. So we'll be able to at least a stopgap there. But with the PPE questions still remain.
yes, with regard to the PPE, and this is my personal opinion, not based on anything other than that, but if we're going to make some type of requirement that employees wear PPE, I believe it's certainly incumbent upon us to provide that for them. I mean, that's a standard practice at our yards.
I would agree with that, Joe. And they actually emphasized that point in one of those documents that Dan provided to us. That I certainly agree with that.
David, do you anticipate getting more for your department or the county use?
Bulk, that's the big question, as we do not know whether that's going to occur or not. I know that they're working to restock a strategic national stockpile. When you multiply what I got, we received on behalf of Oklahoma County, Oklahoma City matched that as well. And then you start looking at the other jurisdictions around the state, you're talking substantial quantities. So I do not know exactly to what depth they're going to be able to resupply that and how full that supply chain through the SNS to us directly is going to be. That's a big unknown for us. That's why I've emphasized that the things that we've got on hand now and the direction we take and the discussion we've had in this committee, this is not an open-ended deal by any stretch. It is a adequate supply for now and will certainly carry us forward for a certain period of time, yet to be determined based on what our initial rollout is. That'll give us an idea where we're going to go. But it is not completely open-ended, and it's likely we will need to supplement that. And that would be another very applicable and appropriate avenue for some of the CARES Act funding as well. So we'll definitely be reviewing that, looking at that.
Finding a source for it is another story.
Absolutely. And that continues to improve, although we've not placed any internal orders. I know D1 placed an order at the same time that my office placed an order, and those have arrived. And I think Mr. Rome may have, I think on the cleaning supplies and that. So we're starting to see supply chain improve, but it's still not bloated by any means, and it's not completely refilled. So you're absolutely right. There will be a time delay there. But again, once we get some basic numbers where we do the initial rollout, that'll tell us maybe what resupply we need to look at. And hopefully by then I'll have additional information from state and the people that are monitoring the SNS, so we'll know exactly where we're going to go. One of the questions put on the end of my document and was included again in the documentation that Dan provided for reentry. There was a lot of discussion in those documents about assessments, an employee assessment or written statement upon returning to work. I do not know that that's necessary, and I would certainly leave that to your wisdom if we want to do that. Something that basically kind of says here's where we are, and you're agreeing to assist by following prudent guidance, those kind of things. Particular interest, and thanks to the report Dan gave, we've only had 2 positive cases in Oklahoma County. There's some specific guidance in that regard too, as to what expectation there may be for somebody who's tested positive, that they will follow prudent containment and distancing and all those kinds of things. So that's, again, back to your legal question, and we'll certainly seek the assistance of the DA's office for applicability for us, but just something to keep on your mind.
One of the questions I have on the assessment is, who handles it? Who does it go to? Who's going to make the decision based on the question, both for employees, for visitors, and for contractors?
Absolutely.
That's going to be a big issue. I don't know.
Yeah, that's bigger than an 800-pound gorilla.
Yeah.
And that goes along with the medical screen, medical testing too. There's a lot of issues regarding the test itself, the viability, the accuracy of that test, whether it's even applicable, because we know what the symptoms and signs say. You may have all of them, you may have none of them, you may be asymptomatic. Who's going to provide that test? Where's that data going? What do you do if it's positive? I mean, there's so many unanswered questions. So, certainly things to be given thought. I would also respectfully recommend that you give additional thought to what depth of PPE. I'm in full agreement with Mr. Blau that if we in fact require the use of PPE on the job, and there's guidance in my draft document as to what level that would go to, that we come up with what's a viable, acceptable number of PPE to be issued. And the easy thought is, okay, people working in offices and have contact with the public here. That's a good baseline to start with. How many masks do we provide to them? Do we provide gloves? Do we whatever? We've got to come up with that baseline so that when I do start contacting offices and work groups and elected officials to get those basic numbers, we can then translate that into exactly what our PPE needs are going to be. Any questions or further discussion?
But we have some offices that are requiring that already, right?
I believe we've heard from a couple of elected officials that are saying that their employees who have one-on-one personal contact with the general public will be wearing masks, yes. That would be likely treasurer's and county clerk's office for sure, and then the court clerk's office because of their interaction with court and the definite increase in activity there. I'm sure that there will be definite needs in that area as well as court itself, DA's office, those kinds of things. Public
defender.
Yeah.
Court services.
So I guess the question is, do those offices since you have access to those masks, are you the one they all go to, or are we going to provide that back to them? And we'll just set a date of here, we'll give you so many masks.
Yeah, I think that's a great question. It's a very important question. I am currently in a position to provide some initial PPE equipment. I think it would be prudent for elected officials and other offices to look ahead as to sustainment in that regard, how long they think they're going to go and what their needs may be, and start preparing ideas about supplemental orders. Because again, the SNS, Strategic National Stockpile, that my resources are coming from, I have no expectation nor any idea clearly of how far that's going to go or exactly how long that's going to be sustainable. So as a backup measure, I would certainly encourage elected officials and other offices to be looking at that and considering it. Keeping in mind what I said earlier too about the N95, the KN95, unless you're directly dealing with healthcare or with positive cases or with gathering test samples, those are not necessary. We're looking at the surgical mask as you're wearing or cloth mask as being deemed appropriate by City County Health Department recommendations.
Do you have the opportunity to trade those N95s to someone for a surgical mask?
I got some will trade you. You want to trade?
Maybe.
Doubtful. Keeping them on hand is still not necessarily a bad thing. One of the things that we don't want to talk about and we're trying to not think about today is future months down the road, fall season, resurgence next winter, spring, whatever could very possibly occur. We get to see good numbers on the reopening and what the ramifications of that are or have been or will be. So there is a possibility that may be necessary there as well.
Okay.
It's not that they're contraindicated, that they would be a detriment by any means, but they're a level of protection that is not necessarily a recommendation at this point. So they're still certainly usable, but maybe a little much.
Well, because Dan had mentioned the second report of a positive within the county family. And this ties into the larger issue of contact tracing, of which is supposed to be one of the significant criteria for reopening in general.
Correct.
As we move forward, I think we need to put a lot of thought and planning into how that will occur within the Oklahoma County family. I'm greatly concerned, and I've said before, that it is our duty to notify our employees that they may have potentially been exposed. And without a comprehensive plan, I'm not sure I'm not saying it hasn't, but I'm not saying that we have. And I just don't know that we know what kind of job we've been able to do in that regard. And so that certainly needs to be a great consideration as we're moving forward. And, the beauty of this place is we have 8 elected officials that have autonomy. And one of the difficulties of this place is we have 8 elected officials that have autonomy, and dealing in a situation like this, trying to come up with plans where everyone is able to have the same information and act the same way is very important. Just because I work for one elected official doesn't necessarily mean that I don't have contact with 7 other elected officials, employees. And so this comprehensive approach to notification and tracing will be extremely important. So I'd ask y'all to really begin to think about that.
Yeah. Very, very valid and well taken points. Unfortunately, with only 2 cases that we're aware of, we haven't had to test that issue to great length. I do know the second one. In fact, I believe you were in the office when Mr. Matthews was notified that that positive case had been identified.
Right.
And he shared at that point the circle that spun up as far as people that had come in contact, and that was occurring rapidly. Your point's well taken, Jim. And that's a touchy topic in that big picture as well. Any further discussion or questions?
One of my concerns is come May 18th, have a lot of the public coming in. We'll also have quite a few more employees coming in, and try and keep our employees separated from the public coming in. We need to move quickly to identify if we're going to have a separate employee entrance. If so, where will that be? How will it operate? I know there's been some discussion about bringing people in on the west end of this building, on the first floor, also through the west gate by the guard shack. As we all know, this is May, and we have significant amounts of severe weather this time of year, and rain and other wind and hail and other things that blow up. And sending people outside to get in, our employees outside to get in, may not be always the best thing to do. One of the things that I had thought about was bringing all the employees through the tunnel, separating our turnstiles there, so the one closest to the wall would be employees only entrance, putting Visqueen or some other barrier up that would allow that tunnel, if you will, and then have the other turnstile as an exit. But that may or may not be possible to do. Then you're going to end up with social distancing for our employees coming in, unless you're staggering work times sufficiently enough that people wouldn't back up. We've got an issue in our tunnel with the roll down right now in the basement lobby, but it's broke, stuff needs to be replaced. So there's some things out there that we need to take, I think, some positive steps on really quickly if we're going to separate our employees away from the public as they come in. Just things to think about. We got about 10 days to make this happen.
Go ahead, Mike.
Dan, I got a question right on that. Is there a reason we can't have the courthouse closed till like 9 a.m. and then ask all employees to be in before that time? That way they can get through the process without being, mixed too much with the public. let's give us some time to go ahead and clean everything down since they got in again, and then have a baseline when the public opens up at like 9 a.m.
Well, that's certainly a consideration. I think you're going to have to talk with the courts about that and get their buy-in on it. I know they're planning, or I've heard they're planning to stagger their court times, but there's probably going to be some judges that are going to want to start court at 9 o'clock. And if we've just got people coming in at that point, they won't be able to do that. I think that's a question for Renee and Judge Elliott and perhaps others on that. You know, I know there are some offices, some elected officials' offices that are delaying their openings at this time till 9 o'clock. There may be others that will want to start at 7 and stagger their people in or bring them in before the crowds start. I think there's a variety of options, but I think we're going to have a coordination of what's going to happen with each of the elected officials and the other departments, as well as the courts, to make sure we're not overloading at any one particular time.
So with coordination, yes.
I'm sorry, I said that again.
So with coordination, yes. Meaning, if we talk to the judges and get everything ready to roll, there's nothing that we're aware of that would keep us from not opening to the public till 9 a.m., assuming that the courts are on board.
I would say that's probably true. If we publicized it, if we made announcements, if we had signage to that effect, but then you get, like we had on a closing or a late opening day a few months ago, you get people lined up outside, and then you get away from that social distancing at that point as well.
Kind of ties in with this portion of the discussion. Who makes the ultimate decisions? Does BOCC make the ultimate decision if we were to say employees only through the west entrance, staggered opening till 9 o'clock for the public, those kind of, who makes the ultimate decision in regard to those things?
Crickets. I don't know. I don't know if the BOCC would make that, if it would be a budget board. I'm not sure that it would be a budget board.
The collaboration of all the elected officials would be critical, but there's got to be a final point. I have a couple of concerns at first blush, too, on what you were describing, Dan, and I appreciate you looking at alternatives. I think one of the biggest concerns I have about whether it's the 18th or whenever it is large groups of people in the lobby areas, elevator lobbies, et cetera. I think even our best efforts are going to cause a large concentration of people, particularly on the first floor, around the entrance, and likely out into the hallways, or excuse me, the sidewalk. I know that the sheriff's office has made mention of additional staffing to encourage social distancing, those kind of things, and that will certainly help. I think there's just going to be a huge bottleneck there. Bringing employees in through a separate entrance could conceivably assist with that. One concern, back to my previous life in regard to your VisClean and that entrance thing, that's interference with sprinkler system and that kind of stuff with the VisClean could be an issue. But, excuse me, I'm definitely in favor of the alternate entry and just have to play it by ear as far as inclement weather. Typically in the morning, we don't have that. Exits won't be an issue. They can still exit the same way we do today. Reduce that traffic flow and possible congestion down there, to me, is a big deal.
Well, even if we bring in individuals, our employees in through the west entrance of this building or through the west gate, they're all going to end up in the lobby anyway. And then you're going to still have that elevator issue.
That's true.
Unless you ask them to go through the courthouse and use elevators there. But when you get people headed to court, you're gonna have issues.
It's on my mind's eye and visualizing that. You shift the load from here to the courthouse or distribute between the two, but you still have the load. That to me further emphasizes the staggered opening. Public at 9, employees 7 or 8, whatever the offices desire.
Well, all the offices have talked about different times and staggering their employees, and I think the courts have said the same. So almost need to do the dry run on the 18th, see where the funnel is.
Well, we need to know what everybody's plan is so that we can make sure not everybody's loading up at 9 or 8:30.
We lost Miles. Okay.
Whether or not, you know, we don't want to, everybody says, yeah, I'm gonna cut my hours back, we'll start at 9. And if everybody in the building does that, then we're not in any better shape than we were.
With losing Miles, so I would, we have 30 minutes. So Kathy, you'll know if he comes back online in 30 minutes. I move we would recess, for 30 minutes to allow Mr. Davidson an opportunity to get back.
I'll second that. Mr. Matthews? Aye. Mr. Blount?
Yes.
Mr. Taylor?
Aye.
And I vote aye also. We are standing in recess. I don't think there's any way around not spreading the numbers.
I just sent Miles a note.
I did too.
Okay.
Can you reconnect?
Yeah. Now we're recessed till 1:30 anyway.
What happened to Miles?
He just dropped.
He went
I'm not
away.
Sure.
He'd heard enough. So are we offline? The little office. Yes, sir. Could be.
Never know. Guessing Armageddon. Remember, Bear, whenever they're reading their hands, this one says that he would like to spend the summer, White Horse, and Bear stayed up there, White House. Oh. Yeah, I think it's nice time about it.
That's
$50 or something. 50 per box.
it varies on manufacturer. We've been getting a lot of
Get box from you.
can.
All right. Then we'll be covered as far as our office.
Okay.
When switches get put.
I wonder if he knows he's gone.
Not sure. I sent him a text and I think,
Hello?
yeah. Dan sent him a text and I sent him one, but I haven't gotten a response.
Uh, If it was her, I knew it'd be trouble.
Just got a note from him, said, sorry, go ahead. So he still has to reconnect, correct? Asking him again if he could reestablish his connection. Of course, they'll have to round everybody else up. He says, yes, I can. No, I will not be available. So what do we do? I guess we can come out of recess without him, notification that he's not.
Can't till 1:30, can we? Because we recessed.
Yeah, we recess till, yeah, he doesn't. I asked him if he could reestablish his connection. He said, yes, I can. Then he says, no, I will not be available. I guess that's vague to me, but he apparently does not want to continue participation.
Are you going into another meeting?
That's what I'm thinking. He's committed somewhere else or something.
No, it would have been nice. The clerks of the board would have brought chili dogs.
I think we need to clarify whether or not it's like here in the meeting, obviously, or meeting, but
We didn't lose our, we didn't have technical.
oh, we did not.
I think he just dropped. He got out.
Yeah, I think he just,
Been nice to be told.
yeah, okay.
He left voluntarily.
Asked him to look back. I said, no, you guys can.
I'm sorry.
Can I tell you?
Oh, he's not? So it'll take all three of us.
What do you-
Right. I sent him a note to see if we had technical difficulties or if he was otherwise committed. He probably said yes.
Miles will not be back at 1:30, he told me.
Okay, did he have technical difficulties or did he have another commitment?
He didn't say. He just said he will not. I asked if he's going to be back at 1:30. He said, what's at 1:30? I said, you. I said, they recessed because you left. And he said, I will not be there. That's all I have.
Okay,
We need to confirm, otherwise we have to treat it like.
okay. Which would mean we're done until Friday.
Right.
Who's going to be blamed? It's got to be somebody to blame. And blame Cody since he left too.
Michael.
Michael was.
Michael left.
Yeah.
Michael.
Michael left you.
Apparently not. You go to lunch? Is that what I thought I heard him say? I didn't realize that it's kind of formality worked this way.
I think the new meeting, lunch audit firm.
So start calling it a lunch. Of course, if really had, but even kind of nasty looking. Okay. If we're all doing it.
They said that 2020 drink, it would be boiling water.
God. too. I like hot dogs, but I wouldn't consider drinking that water. I guess it's sanitary if it's water.
That's what they've got the dog at Coney Island in, boil weenie water.
Oh, I know. It's a natural byproduct, but
There you go.
it's not one I would pursue.
No. I'm sure there's some medicinal purposes.
From Coney Island, likely. It's got a lot of antibodies in it.
Yeah. Or something.
Yeah, or something.
Corona cure.
That sure sounds good. I actually grilled hot dog before last.
And maybe that's burgers.
I gotta go get me some Wolfman chili. I had some of it. And yeah, exactly. It's terrible, but it's such a staple. Yeah.
When was the last time you had a big human bowl?
I honestly can't answer that. I like taking leftover grilled hot dogs, chopping them up, putting them in a pot. Yeah, that's healthy.
Healthy, that might be a stretch.
Chop a few onions up and throw them there. That's good stuff.
Some grated cheese.
I may have to pick up a can of chili on the way home because I've got 4 or 5 hot dogs sitting there. My wife won't eat them, but I'll just sit down with the pan.
When you grill your dogs, you burn them.
Oh, yeah, that's true.
That's the way I like it.
So if I'm not here Friday, you know what happens.
Right.
Yeah, there's a basic deal, a little chicken noodle soup. Yeah. Been there.
Nothing wrong.
No, that's a comfort, stability food there. Tomato soup
Yeah.
with milk, not with
Milk,
water.
not with water.
Yeah.
Yeah, you're right. And a grilled cheese.
Yeah, when you start feeling really better,
Yeah.
applesauce.
Not hungry.
Yeah.
Just a bit, yeah. My lunch is sitting down there waiting. Of course, I've got a 2:00 conference call with a bunch of bonehead fire chiefs. So.
I had a handful of pretzels in my office. I think. Has Greg said anything about tomorrow's weather?
No, haven't heard anything. Shoot him a text. That'd be a good distraction.
Oh, National Weather Service, their graphics a little earlier, but most of it's out west of us. Big stuff.
That's what, yeah, I saw that on the website.
Tennis ball size, they all.
Miles says otherwise committed, so it was not technical.
Can they go ahead and start without George?
Yeah, if Joe was here, we could start doing that.
No, not till 1:30. We
Yeah, at
30
1:30.
minutes. Yeah. Mhm.
Governor will address the state on COVID-19. And which was the CARES Act money. Maybe coming back around for another pass. Yeah. Oversight. I think that bus maybe.
You guys discuss miles.
Yeah.
Okay, we're good then. It's not a technical thing, not a technical issue. Okay, perfect.
So, yeah, at 1:30, we can rev back up.
If I leave, is it a technical difficulty, guys?
We lose our quorum, Michael.
I know that I'm technically difficult.
Technically speaking.
Yes,
Yeah, we lose our quorum and then we down to the till 5.
Michael.
Taylor not coming back?
We're still on the air.
I'm fine. On the name.
The name of it? This would be the Emergency Response Committee. Dealing with emergent issues.
Emergent?
Some of them. Governor's apparently doing a press briefing right now.
I appreciate you letting me know that it's live.
I emailed earlier today,
Or certified.
Probably, yeah. I would, so you decided to divide and conquer the conquer? But as I try to tell everybody, just because you can. That's damn right. Unintended. We're gonna send out a special statement about tomorrow, or those kinds of days, or?
No, I asked Greg, and he didn't seem too excited. He's going to look at it before. We've got a 2:00 conference call. He's going to look at it with the Eastern Fire Chiefs. He's going to look at it before then. But the graphic products for the service kind of look more southwest.
I knew you would be back. They all said you weren't. It's an emergency.
Cody, thanks for having faith in me.
Yeah, your counterpart, so now I can. Hey, so it's a big deal here.
There was some big the other day. See any of those pictures?
Yeah. Yeah, and I also saw some pictures of some of my kids that used to coach, literally out with their helmet on doing batting practice. And I had to send a deal and say, Mike, the helmet is protecting your head from hailstones, but your bat is attracting the lightning because it's a metal bat.
But.
Send those Norman kids.
Yeah.
Send those Norman kids.
Actually, one of them is she.
So were they enjoying those smacking the hailstone?
Yeah.
It does sound like fun, but I think your point supersedes that.
90-mile-an-hour hailstone.
Yeah.
It's kind of like dodgeball. If you can dodge a wrench, dodge a ball. Well, if you can hit a 90-mile-an-hour hailstone,
But coming down.
Like, wouldn't know you would say that. That was one of our hitting. I would get up and I would rock from
Just
below. From above.
Eye-hand coordination.
Yeah. And then I would take, I had some older white softballs and yellow ones, and then we would also put dots on it. And I would do side toss. I would pull 3 softballs. One of them would have a dot or a line, or one of them would be a color. And as I throw it, I tell them to hit, so they've got to hit the right ball. And
That's good. Like that. What point of discussion were we making on item number 7? We need to revisit who makes a decision as to open alternative doors, et cetera. Talking about coordination of elected officials, start times, yeah.
Things happen.
That young lady down there said you left, you were mad, you weren't coming back.
I heard her.
I think somebody told her that, though. Do we use that as the official clock or what we've got on here?
I don't know.
It says 11:26. We're ready. Welcome back. It's 1:30. And entertain a motion to come out of recess.
So moved.
Second. Motion second. Mr. Matthews?
Aye.
Mr. Blau?
Yes.
Mr. Taylor?
Aye.
Mr. Davison is not with us now, and Barnes and I think we were in the process of discussing alternative entrances for employees.
Do we need to clarify
Okay.
the reason he left?
The reason he left is a previous commitment. It was not related to technical difficulties. Very good. Got it. We were discussing alternative entrances for employees and the importance of coordination between elected officials and the scheduling of, the staggering of schedules. And who makes the final determination as to whether alternative entrances are implemented? I'm guessing the staggered schedules will be up to each elected official, but the coordination would still be a critical factor. It would be appropriate for this committee to make a recommendation to EOCC and elected officials or budget board or whomever to implement alternative entrances. That'd be
David, I think that's certainly appropriate. I think if we go back to our Monday meeting, there was a statement that there would be a new order forthcoming from Judge Elliott that would provide some clarification. As of yet, I don't believe that order's been made public. I think we may need to wait on any type of recommendation so that we can see the order and what impact it might have on that type of a decision. So if we get that order before our Friday meeting, or even at any point during our Friday meeting, we would certainly have time to get something on to the BOCC agenda for Wednesday in regard to some type of recommendation.
okay. Sounds good.
I wanted to come speak on your,
Okay.
I'm allowed to whenever the time is right.
I believe that's appropriate. We're under item 7 regarding the reentry provisions planned for Oklahoma County. So, Renee, please
Thank you.
come forward. Thank you for coming.
Yeah. I would anticipate this afternoon or tomorrow
Okay.
seeing an order coming from the court. One of the things that we are going to be doing is staggering our docket times so that we don't have everybody coming in the building at one time, and staggering lunch hours. Sorry, I ran down here really quickly.
You're fine.
Staggering lunch hours and some of those things. With that in mind, I would anticipate 2 or 3 dockets potentially starting at 8:30.
Okay.
And that's just so that we can, again, stagger our lunch hour, stagger from having so many people in a hallway on any one given floor, and then moving forward, after we get past this first little bit where dockets are already set, we'll be adding more dockets so we put fewer cases on a docket. In order to accomplish that, it is going to require us to start some of those dockets at 8:30.
Okay.
Renee, will you educate me with regard to the dockets?
Right now,
Is it just a general call in terms of you're on the 8:30 docket, so you need to be here, or is there the ability to provide some timing within the document to those that are supposed to appear?
that is what we're going to be working on in the forward, is moving forward. Unfortunately, what we have right now with our dockets that are starting back, some of them on the 18th, is they're already been set, notices, required publication issues have already taken place, and so they can't be changed. And so we're going to be splitting some of those dockets up between judges to try to keep those from being in the same place, some of those, but also part of what we're going to be doing with our new dockets that we are going to be adding, so that instead of 100 cases being on a 9 o'clock docket now, we would have 25 at 8:30, 25 at 9:30, and having to spread them out through the day. And so in order to accomplish that, we would need to be able to start that at 9:30 so we can get everybody out of the floor, people back in, understanding that with the 2-person rule and the elevators both at the parking garage, them getting just from the parking garage over here, and then us, that it's going to create a problem with our larger dockets that we generally have, so that we are working towards reducing. But again, understanding that the first day or two is going to be kind of like it was the first day or two when we started the shutdown. It's not going to be perfect the first couple of days when we get it there.
Sure.
Do you anticipate that the number of people will be limited as far as the defendant and no one else, or?
Well, constitutionally, there are certain folks that have a right to be there, particularly when you're talking about criminal cases. There are constitutional requirements under what's known as Marcy's law, that the victim has every much right to be there as does the defendant. So what I anticipate seeing is something towards the effect that it's going to be your attorneys, it's going to be your litigants, it's going to be victims that have to come in pursuant to Marcy's law, or their victim representative. Some of them will choose a representative as opposed to the victim themselves. I mean, there's more victims. And then a family member or a defendant. That's in criminal cases. In civil cases and other matters, it should be only the people that have to be in court. It's not going to be people that just want to come watch. My daughter's going, being sued by doing the laundromat because they rent her shirt and I've got to go to court her. That's not the kind of thing that's going to be happening. It's truly going to be very limited into people other than those who are actually convicted. And those would be just, like I say, the victims. And I would also anticipate what we're looking at for May 18th is obviously going to be more than what we're doing now, but still less than it would be if we were full-blown going forward. We're still going to have a lot of things that we're going to expect to be done via video. We're still not going to totally open up for non-emergency. There are just a few things that we have to get back started.
Will there be any, and you may not know this yet, any provision in his order that people need to wear masks or they need to not present themselves if they are?
Let's not put Renee on the spot.
Okay.
Let the order speak for itself.
All right. Thank you. Thank you, Joe. Keep me straight.
Thank you, Renee. Any further discussion or questions regarding item number 7? Accept her report or information.
To accept the Troxel's report.
Just our discussion into.
Okay.
Yeah.
Move to accept the reports.
Second.
Motion and second, Mr. Matthews.
Aye.
Mr. Blau.
Yes.
Mr. Taylor.
Aye.
And Barnes is an aye. Thank you. Motion to reopen item number 8, discussion possible action to determine next meeting date and time.
That's already scheduled for Monday at noon.
Any board comments? Stan?
None.
Bill? None from me. Thank you all very much. I'll entertain a motion to recess.
Recess until Friday, the 8th, I believe it is, at noon in this room.
There a second? Second. Motion and second, Mr. Matthews.
Aye.
Mr. Blau.
Yes.
Mr. Taylor.
Aye.
Barnes is an aye. We stand in recess to Friday, May 8th, Board of County Commissioners room at 12 noon. Thank you.
And I'm not old lady, and I'm not used to running.
Joe started talking.